I know you get asked a lot, but what's your favorite part about being a surgeon?
I do get asked that a lot, but I don't mind answering it, and my answer is always the same, which is the same patients. Um, you know, I develop relationships with our patients from start to finish, and I cherish that part of my job.
Dr. Robbins came in, and with my personality, I started messing with him right away. And now when I come in, I get hugs from the entire staff.
But in the end, we help them. We take people who are unhappy or have things that have been troubling them and help them achieve their goals. And we want to see people leaving our office happy and confident. I love that part of my job.
As you can see, I'm very satisfied.
The greatest compliment I had today is someone like my beard. But no, I know that's not what you mean. The greatest compliment I could receive or the greatest reward, it's really the same answer. The most rewarding part of my job is seeing happy patients and happy people after they've been in our care.
Everything is amazing. I've healed really well. The results are phenomenal, far better than I ever imagined. And
my surgeries have gone wonderful with no complications.
I feel like you saved my life. And
when people are happy, it tells me that, number one, we've done a great job. Technically, we've helped them achieve their goals. Number two, that we have cared about them appropriately, whether that means being available for them when they have a time of need or going the extra mile to help them with a particular thing. It tells me that our staff have done a great job. I hear that all the time.
They have checked on me. They have been really attentive to what my personal needs were.
And his staff is like family to me now. I love them with all my heart.
And how compassionate and wonderful they are. So if we're doing all those things, that translates to happy patients. And the best thing I could hear, or the greatest reward I could receive, is just having happy patients.
It's been the best thing I've ever done for myself.
Tell me some ways that you can relate to your patients.
That's a great question. I think number one, it's just a human thing, which is empathy. Regardless of whether someone's your patient or not, maybe it's just someone you interact with outside the office. But
he's very caring. He's a perfectionist. I am too. And I wanted to be as perfect as I possibly could be.
But this place treats you the way you deserve to be treated.
To relate to patients, I think the first thing you have to do is just be empathetic. And, aside from that question, how do you relate to patients, I just think it's a human thing. How do you relate to people, right? You try to put yourself in their shoes, be empathetic to their situation, understand where they're coming from. It helps you connect with folks. And importantly, it also helps you understand what their goals are and how you can help them. So that's a big part of it. The other part of that, which is related, is being a good listener. We really try to take care to listen to folks, hear exactly what it is that they're concerned about, and just take time to hear them out.
And everybody made me feel really, really comfortable.
They're always there for you, whether you're coming to the office or you just pick up the phone.
Always made me feel so comfortable. No one judges you. No one gives you that side eye.
Within 5 minutes of my consultation, I knew I wanted him as my surgeon.
And a good example of that might be something as simple as a breast augmentation. It's important as a conversation starter to ask, what cup size would you like to be? That's important to know, but it's more important, I think, to know what's their activity status. Are they physically active? Are they working out a lot? Not so much. Do they want something that looks more natural, more obvious? What types of clothes do they like to wear? Where do they like to go? So I think it's really important to hear folks out and to take all that information together and get a more complete picture of what it is they're trying to achieve.
And Dr. Robbins told me about all of the different procedures, but I never felt pressured in any way. I didn't feel like anybody was pushing me to do more than I wanted to do.
It's all those things combined. It's being a good listener, taking the time to sit down and understand a person's perspective, and to be empathetic with them, trying to understand their goals, that, combined with going the extra mile to help them achieve those goals, combined with top quality results, combined with excellent, compassionate staff, I think the folks who come here deserve the very best, and I feel confident that we can help them achieve that.
My surgeries have gone wonderful with no complications.
Now, I never thought that I would be someone that had other people wanting a body like mine.
I'm more confident, and this just puts an exclamation point to happiness in my life. So
I just couldn't be more thankful to him and the staff.
And I just can't thank you, Dr. Robbins, and all of you girls very, very much.